Hello friends, today we will discuss about the local anesthesia, type of local anesthesia. First of all, we will discuss about what is local anesthetics. A local anesthetics is a drug used to reversibly prevent the transmission of the nerve impulse in the area where it is applied without affecting consciousness of the patient. How do local anesthetics work? Induce loss of sensation, hence locally preventing pain in a well-defined area of the body. When propagation of the nerve impulse is prevented, then there can be no sensation impulses reaching the CNS or brain. Local anesthesia LA are eliciting their conduction blocking effect by reversibly blocking the movement of sodium inside the nerve axon required for action potential. There is a diagrammatic representation of how local anesthesia stop nerve conduction. Some more detail about the local anesthetics are: local anesthetics reversibly block the movement of sodium in and out of the cell at the region where they are applied. Without sodium, there can be no nerve depolarization, hence no action potential propagate. Lack of action potential impulses implies loss of sensation, which include the absence of painful sensation. Type of local anesthetics. There are two main types of local anesthetics, amide and esters. All are Both types of local anesthetics are made up of three main components: a lipophilic hydrophobic aromatic compound, an intermediate chain lineage which can be either an ester or an amide. There is a part which allows the distinction between the ester and the amide local anesthetics. Hydrophilic amine. Amide versus ester. Ester are easily broken down by pseudocholinesterase in the plasma, therefore they have much shorter duration of action. Amide are stable in a plasma and they have only broken down in the liver, have lower potential to produce allergic reaction than ester. Example of amide local anesthetics are lignocaine or lidocaine, bupivacaine, pilocaine, atricane, mepivacaine. Some examples of ester local anesthetics are procaine, benzocaine, cocaine. Lidocaine 2%, 20 gram is the most common local anesthetics used in dentistry. Gold standard used for over 50 years in dentistry. Lignospan, xylocaine. 1 ratio 80,000 adrenaline as a vasoconstrictor used with the 2% lidocaine. Maximum dose is equal to 500 mg or 11 into 2.2 milliliter for a 70 kg man. Pulpal sensation reach about 45 minutes of tissue log, 2 to 3 hours. Half life of lidocaine is 90 minutes. Topical preparations of these uh, local anesthetics are also exist in the dentistry. Vasoconstrictor. Adrenaline, naturally occurring hormone, give more profound anesthesia, improve control of hemorrhage, especially in infiltration type anesthesia, reduce systemic absorption, hence prolong the duration of pulpal anesthesia, reduce the toxicity, hence we can probably inject more anesthetics. Vasoconstrictor. Phelipresins, a synthetic octapeptide similar to the pituitary hormone vasopressin in dental LA, added as 0.3 ml to 3% pilocaine. Not as effective as adrenaline, hence poorer hemorrhage control occur. Does not have the unwanted side effects of the adrenaline palpitation. Complication with vasoconstrictor are: adrenaline can induce tachycardia, fainting. Adrenaline is contraindicated in patients with unstable hypertension and unstable angina pectoris. Adrenaline is contraindicated in patients taking monoamine oxidase inhibitor. Vasopressin is contraindicated in the late pregnancy stages. Choice of anesthesia depend on the tooth that need to be anesthetized. Maxillary infiltration type of local anesthesia is used. Mandibular nerve block types of the local anesthesia is used. Depend on the type of treatment you are going to carry out. Extraction, all nerve in the area need to be anesthetized. Main supply plus accessory nerve also. Restoration plus perio treatment usually sufficient to block main nerve supply. There is a diagrammatic representation showing the infiltration versus nerve block. Infiltration anesthesia act locally to provide good LA, effective on local soft tissue, act on the teeth where bone is relatively thin, used for upper teeth, mainly the lower interior teeth. Anesthetics diffuse through alveolar bone to root apex, not as effective on the posterior mandibular teeth due to thick cortical bone. There is a picture showing buccal infiltration. There is a picture showing palatal infiltration. Nerve block anesthesia. Anesthetic delivered to the major nerve. Block all sensation downstream to the injection site. The more proximal the nerve the block, the greater the area affected. Commonly used nerve block in dentistry is inferior alveolar nerve block, mental nerve block, lingual nerve block, long buccal nerve block, greater palatine nerve block, nasopalatine nerve block. Inferior alveolar nerve block, nerve affected inferior alveolar nerve, mental nerve, and incisive nerve. Target area mandibular foramen within the pterygoid space. Tissue anesthetize all mandibular teeth, skin of the chin, labial mucosa, and the lower lips, left or right depending on the side of injection. Inferior alveolar nerve block. Anatomical landmark chronoid notch, pterygomandibular raphe, occlusal plane for mandibular posterior, direct technique, palpate and identify injection site, advance needle from contralateral premolar, horizontally 1 cm above the occlusal plane. Needle goes into 2.5 cm head bone, retract needle 1 mm, aspirate, inject slowly. Inferior alveolar nerve block, there is a picture showing diagrammatic and clinical picture showing inferior alveolar nerve block. Complication of LA, pain, swelling, spread of infection due to injection, use of needles, facial nerve palsy due to injury by the needles to the facial nerve, bleeding, allergy, trauma to anesthetized tissue. Thank you very much.